welcome to this Stepping Stones webinar, as we're calling it. The aim of the webinar is for us to explore those steps that any social worker can take in order to take forward better working conditions. So it's really kind of from small acorns, oak trees grow, or whatever the correct phrase is that even small changes in the workplace can make a really big difference, both for you and for your colleagues. As I said, we are recording this, so it will be a resource that's available after the event. And I'd just like to thank our partner trade union, Social Workers Union, for organising this, for giving me the opportunity to chair it. We've got a fantastic range of speakers for you, and hopefully this will give you real food for thought, and there'll be a chance for you to ask questions and have some discussion with our speakers later on in the webinar. The webinar is scheduled to last for an hour, and we will keep to time. And we will hope to explore some really key topics that we know from our survey work, and of course from talking with our mutual members, our SWU members and BASW members, the sorts of things that we're hearing through our advice and representation service. SWU is hearing through its trade union work around key issues around discrimination, neurodiversity issues, tackling burnout, supporting women during the menopause, a whole number of other matters that are on our minds about what we need to do to improve working conditions. And no doubt you will come forward with your questions on some other issues as well. So this is, we know this is a very difficult time in public services. It's an understatement to say that. It's a time of great economic difficulties, cost of living crisis that is hitting social workers and other public sector workers alongside others across our society. And there's a growth of union disputes across many industries, which we're all very aware of. And I think there's the growing sense that it's really important that we are all standing up for our rights as workers, wherever we are, whichever union we're part of, and that we come together as well as social workers to support each other to take action on better working conditions. So those are some of the themes that we will be able to explore today. This is a public forum, so we can't obviously deal with any personal issues that you might be experiencing at the moment, but we want to hear the points you want to raise about the themes that might be affecting you or your colleagues, or that you're concerned about in social work. So please raise those. And throughout, please put your comments into the chat box, and we will use those to take questions once the speakers are finished. Of course, the advice and representation service that is run for SWU with BASW is available there for you if you're a member of BASW or a member of BASW and SWU. It's there for you, and you can use that, and there'll be information about that, I think, going in the chat as well. So if you could please stay on mute unless you're actually speaking to a question or in a discussion in the second part of the webinar, we'd really appreciate that. And I'd just like to thank you all for coming, thank our speakers in advance, and I'm going to hand over now to Lisa Fitzpatrick, who is one of the ANR and trade union officers in the ANR service. Lisa, over to you.
Hi, thank you, Ruth, and thank you everybody for coming here today at 6 o'clock. I'm sure you've all had very busy days, and thank you. I'm delighted to be here with my colleagues, peers, members, and some of what Ruth was saying basically resonated in terms of what our team is working with is the day-to-day realities of members who are facing burnout, long-term sickness, discrimination at work, inequality at work. The list goes on, and I know I don't need to run through that list at any great length because you all know what I'm talking about. But I'm just going to touch on just a few themes, if you'll bear with me, in terms of the work that we're doing really as a team. I mean, essentially, I qualified way back in the 90s, but for too long, even then, but worse now, social workers are made to feel that stress, long hours, heavy workloads, unrealistic targets are part of the job. And there comes with that the expectation from employers somehow that it's okay for social workers to sacrifice their lives and their families to do a job, essentially. And we know that the word vocation comes with the profession, and we know the commitment and the kind of the passion that comes from our members to do their job. But in some workplaces, sadly, we're seeing toxic cultures and blame is prevalent. People feel afraid. They worry they can't speak out for fear of reprisals and about how their managers will respond. And the irony of all of this is within a social care environment. Some of our members talk about bullying cultures where they just can't have open and honest conversations with supervisors. And that's what most members are desperate to do. They want that really important relationship with supervisors. We have to remind, our role is to remind employers that they have a duty of care towards employers, and that includes health and safety, fair treatment, and that you must not be discriminated against because of characteristics under the Equality Act. The advice and representation team can give advice on these matters, and we've left the contact details for any of you who want to contact us. But as I speak, I'm very conscious and aware that we have members who are currently at home on either short-term or long-term sickness, some for months, sometimes longer, who are saying to us they feel isolated, alone, anxious, and they just don't know which way to turn. So this idea came about really was just to say, to bring people together. Our profession would be good at that if it wasn't under so much stress, but social workers are good at that, and to bring people together and to talk about where people are at. What I want to say as well, just a reminder, there are some employers out there who will listen, who do take active steps to respond, and who will create positive solutions. This makes all the difference. And I also want to give a message of hope around that. Changes can take place. They do happen. And sometimes we see some of our best managers and senior managers out there creating better cultures and working places. But sometimes it's you as members that have to, raise those issues and escalate the issues. We will work with you to help you build bridges where we can, and in a solution-focused way with employers. And what we hope as well is that organisations will learn from that. So I'm just going to wind up. I think I've probably got about a minute, Ruth. And just to say that the many issues we deal with are health problems in terms of processes, flexible working appeals, some are upheld, changes of hours being agreed to accommodate childcare. So what can members do? I'm just going to wind up. You can make a start, take small steps to start conversations with an employer, raise the worries, use processes that exist to escalate concerns. You can do that via informal and formal actions. I'm sure we'll go on to talk a bit about that later. And what I'm going to do is I'm going to end at this point so that I don't take up too much more time. And we often say to our members that taking the small steps to address problems at work does make a difference, helps develop confidence to speak out and to try to move forward. On that note, I'm going to hand you back over to Ruth, but I know we've got speakers here today who have taken some of that action and who will share generally their experience with you. So on that note, I will hand back over to Ruth. Thank you.
Lisa, thank you very much indeed. I'd like to come now to Parveen, and if for all of our speakers, if you could just introduce yourselves, that would be great, so people can know a bit who you are before you present. So over to you, Parveen, for 5 minutes. Thank you.
Thank you, Ruth. So good evening, everyone. It's so great to see so many of you. My name's Parveen. I'm a social worker and the head of Equality, Diversity and Inclusion for East Kent NHS Trust. I'm going to be briefly talking about my experiences when I was a team manager of a mental health social work service for a local authority. So in summary, some of the challenges I faced. I faced greater scrutiny of my work than my peers, despite turning a failing social work service into the most productive in the locality with the highest levels of job satisfaction for frontline social workers. I was not listened to by senior management. My ideas were not taken seriously. I had to work 10 times harder than my white colleagues in similar positions for no reward, no recognition, and I was under constant scrutiny. I faced discrimination from my line manager and assistant director. This was based on race and disability. I have physical disabilities and neurodiversity, and the reasonable adjustments I needed were not put in place. These issues were ongoing for over a year, and it greatly impacted my mental health and well-being. So the first step I took to try and resolve this, I tried to raise concerns with my line manager via discussion. She dismissed these ideas and denied the issues, basically, and then I was then accused of not being able to do my job properly. The first contact I had with the Advice and Rep Service Social Work Union was in December 2021. They were extremely helpful and friendly. I was swiftly called back to discuss the issues in more depth. I think it was actually later that day. As the issues had been ongoing for some time and not resolved and had worsened, someone was promptly allocated to my case and really listened to my sort of experiences and what I'd been going through. And to be honest, I wondered why I'd waited so long to get in touch with them. What has improved for me? By getting the A&R service involved, my manager realised that what I was raising was actually serious, that I was not prepared to tolerate it, and so did the assistant director. The rep met with me before meetings and gave me advice on how to communicate my feelings in a calm and productive way, because at this point I was at the end of my tether and very angry, and I think that was coming across and I wasn't being heard. The direct discrimination I experienced lessened. I ended up leaving that role, and I've now moved to work in equality, diversity and inclusion, which I'm hugely passionate about. I now use my personal experience to empathise with others, advocate for other people going through similar things, put in place strategies, training, workshops to address discrimination and create a better workplace culture. What piece of advice would I give to someone facing challenges at work? First of all, I would say it's not your fault. You can be made to feel as if it is your fault and you're the problem. I have been there. I know exactly how that feels, but I would say just try to remember it's not your fault. Seek support from your staff networks. The Bain network where I worked previously was incredibly supportive. It was a space that I could go to be listened to and vent away from my work role. And last piece of advice I would give is keep a list of incidents. So if you do decide to raise something, whether it's formal or informal, you've got all the information and evidence to hand. Back to you, Ruth.
Thank you, Parveen, for that really, really clear exposition of what you've tried, and I'm glad to hear the A&R service was able to support you and for you to go on that journey. Thank you. I'd like to now go over to Deb Solomon. Deborah, would you like to introduce yourself, and over to you for 5 minutes? Thanks.
Hi everyone. So my name is Deb Solomon, and I've been a social worker since 2018, and I was diagnosed with ADHD in 2020, and I'm just waiting for my autism diagnosis at the moment. And so for me, I think the challenges have always been very much about understanding myself, and I think there's a lack of awareness within the profession about neurodiversity and kind of how that looks like in people like myself, someone that's working within the profession, somebody that's going out and about, driving, working, and there's a lot of stigma around neurodiversity. So a lot of social workers don't always feel safe to seek support, and if they do, managers don't always know what to do with that anyway. For me, I didn't know what I needed. I'd just been diagnosed, and when someone says to you, okay, what do you need? I have no idea. I didn't know what it meant, what I might need, what might help. So I didn't know what reasonable adjustments might be useful. And so And if I did ask for help, I felt that that was kind of me saying that I was incapable and less than. So I struggled, and I would work, 3, 4, 5 hours sometimes a day, more than anybody else, to try and do what I perceived as being as good as everybody else. And as we know, what that does is lead to burnout. And masking is exhausting, trying to kind of be like everybody else, trying to appear like everybody else, and not always having your peers understand how you work, how you communicate, your traits. It leads to exhaustion, it leads to burnout, and it leads to mental health issues. Other challenges with the working environment, it's not always neurodivergent friendly. So, the office is noisy, the lights are really harsh, it's really difficult to focus when everybody's talking all at the same time, and you take yourself off to a quiet place to sit and work, but then you're branded not a team player. So then you try and join in, and then you're then having to work even longer to make up for the work that you've just missed because you're trying to join in. You can see the cycle that it goes because you're trying to kind of be what you think you should. So the first step that I took really was sharing my story. I wrote a piece for Professional Social Work magazine just about my experiences during lockdown and just how I was feeling. And actually, the response was there were so many other social workers saying, "Wow, this is me. I'm like this. I am you." And I think for me, that made me realise that it isn't my fault. It isn't. I'm not the odd one. I just work differently. But that's actually okay. I was also lucky enough to have a director within my local authority who has a real sort of passion and understanding for neurodiversity. So that really helped. But what has improved for me, I think, is since doing this, I've set up a group for neurodivergent social workers, both within my local authority and within BASW. And I think it's having that space to understand myself within the profession, within my local authority, that I'm not the problem, and that a lack of awareness isn't an excuse to kind of not give support. And I now feel able to be open about what my needs are, and actually it's a sign of professionalism to be able to say, this is what I need to work at my best, this is what I need for you to get the best out of me. That isn't a weakness, that's a sign of being that is a sign of professionalism. That's a sign of knowing how you can best support people. And now I'm actually able to support other people within the local authority. I sit on the Equality, Diversity and Inclusion Board within my local authority and within BASW. So my voice, it feels like my voice is being listened to now. The piece of advice I would give is understand that it isn't you. You have strengths that you bring. You deserve to be respected, and you deserve to have your story heard. Find an ally. It's a big thing to take on this journey. So try and find an ally of somebody that can either understand your journey, that can sit alongside you. It's a heavy journey to take, but it isn't always your responsibility to educate. It's an equal responsibility to your employer to understand your needs and how they could support you. And if you have a network group, reach out to them, because that peer support is absolutely essential. Don't be alone. Back over to you, Ruth. Thank you.
Thanks very much, Deb, and thanks for all the work that you're doing around the neurodiversity group in BASW as well. It's really very important. We're now coming to Callum. This is there are 3 more presentations, just so that our participants know. 3 more short presentations. And Callum, you're next. So if you could introduce yourself, and you have your time now.
Thanks, Ruth. Hi, my name's Callum Gallagher. I'm a social worker. I have been for 14 years, employed as a team leader. I'm going to tell you about my own very recent experience of burnout because of work-related stress, which ultimately was caused by working excessively long hours to cover an unmanageable caseload, with very limited support to include an absence of supervision. You know, I then experienced feeling unsafe at home because of a client-related incident that took place at my home. I was unsupported with that, and realised that my core values were constantly in conflict with the organisational politics, practices, and the managerial approach taken by my employers. Ultimately, it had a really devastating effect on my well-being. I didn't go out for 3 months. I had a long-term absence from work. During that period of absence, my employers tried to use HR procedures to intimidate me and bully me. My challenge of practices was taken as an inability to fit in with the culture. You know, but the impact on me physiologically, psychologically, was that, you know, I couldn't sleep progressively over time, or I'd waken really early in the morning, 2, 3, 4, not be able to sleep, constantly be thinking about work, would then get up and start to work. I would be criticised for working too early. You know, my general demeanour changed. I couldn't communicate with my wife at home. I was more and more isolative and cut myself off from people. You know, I had some really quite morose thoughts. I can look back at it now and see how skewed my thinking was now that I've recovered a bit. But, you know, I was going for a fairly standard operation, and I remember saying to my wife, "You'd be better off without me. You know, at least if I die, you'll get a death in service payment." She, of course, thought that I wanted to complete suicide, but I didn't. I had no plans to do that, but I had no hope. Just felt complete despair, and that I wouldn't be able to continue being a social worker. I tried all the usual means. You know, I spoke to my GP. My GP agreed that I shouldn't have to take medication for a work-related issue. I used the employee assistance programme, not to any great benefit. The occupational health doctor agreed with my GP it was an operational issue. And I then had the opportunity to go on a wellbeing pilot that BASW promoted, and it was delivered by CLIP, which is Key Life Indicator Plan. My first step in trying to address the challenges I was facing at work was to have an open conversation with management. I did contact SWU A&R quite early on, probably 12 months before my absence, and they advised that, you know, my employers had a duty of care to me for my health and safety, and that really they should be doing a stress at work risk assessment with me to try and reduce the impact operational difficulties was having on me as a person. Yeah, SWU were very good. And, you know, what I would say has changed for me or improved since this episode is my overall well-being, you know, and that has been directly consequent to the coaching sessions I've had from CLIP, which have been about professional coaching, mindfulness. And I found that during the pilot, after about 3 weeks of the pilot, my sleep drastically improved, because I was able to make sense of what was happening to me at work. You know, I was able to understand that my reaction, my physiological and psychological reaction to prolonged stress was completely natural, that my limbic system was in overdrive, and that, you know, this is a normal response. This was not a failure of my personal resilience. And from that, I was able to process a lot of the events that had happened at work and start to accept them and move on, because I was really, really stuck in what was happening and I couldn't look at the future. And I did get back to work, and I developed strategies that I could use on a daily basis to manage some of the pressures, because those pressures are not going away for any social worker. And I became confident in setting boundaries. Sorry, Ruth. But my advice is that if you're struggling, if any of what I've said resonates with you, don't just plod on. Ask for help. Keep escalating the issues. If you're not getting help from your employer, then you can reach out to your professional body, or even try CLIP. You know, anyone can email CLIP at hello, which is hello@clipglobal.com. Thank you.
Thank you very much, Callum. Thank you for that very honest sharing, and I'm sure people really benefit from hearing your story there and how the support you got to help resolve that. So thank you. Could I come now to Sharon? Please introduce yourself, Sharon. Thank you.
My name is Sharon Nightingale, and I'm a senior social work practitioner and AMP in a working age mental health team. The challenge I faced, I will class as menopause-related burnout. I've taken on a new role and had a difficult year with 2 family bereavements, a serious chest infection, and all of this was in the midst of the pandemic working conditions. I kept going, telling myself that it was just a difficult time and I'd get through it, but the physical symptoms got worse. Anxiety, brain fog, low mood, disturbed sleep, and I started to get to the point where I really thought I wasn't going to be able to function. I felt dreadful, but kept going in. I contacted my GP and my hormone levels were tested and they were rock bottom. Not only had my HRT stopped working, but it was affecting my blood pressure and my heart. So I was facing a serious heart condition. In 2021, the Newsom Health Research and Education Foundation surveyed 3,800 women, and 99% of women felt that their perimenopausal or menopausal symptoms led to a negative impact on their careers, with more than a third describing the impact as significant. 59% of the women took time off work due to symptoms, and 18% of them were off for more than 8 weeks. The reasons for taking time off included reduced efficiency, poor quality of work, and poor concentration. Half of the women who took time off work resigned or took early retirement. 1 in 5 women felt they'd been passed over for promotion. 19% reduced their hours, 12% resigned, and 60% said that their workplace offered no menopause support. My first step was to acknowledge that I couldn't continue as I was. I was functioning. I wasn't living, I was functioning. I needed to take my health seriously because I was facing a life-changing heart condition. I had an initial meeting with my manager and I requested an occupational health report. I made a request for flexible working, and I put everything into emails describing my symptoms, my GP's tests and views, and what I felt would help. Unfortunately, that number of weeks went over and there was no change. I felt very frightened. I felt I had to choose between my health and my career, and I felt totally powerless. My first contact with the social work union was when I submitted a grievance. I hadn't expected to have to follow any formal process. I thought everything was fairly straightforward. I didn't expect to have to fight in any way for anything. It felt uncomfortable. It felt confrontational. But I still didn't feel I was being heard. We advocate for our clients every day as social workers. We support them to make changes, and we identify solution-based options, strengths-based options. We represent their rights and we prevent them from being discriminated against. I realised that I needed someone who knew what they were doing. I know social work law, I know mental health law, but this wasn't about social work. This was about employment law and employment issues. I needed someone who understood employment law from the point of view of a social worker, someone who would be taken seriously and not seen as a neurotic middle-aged woman, because it was my health and my career. You know, what was I willing to give up? What was improved for me? At the end of the process, I was redeployed to a different role. It's still very much a work in progress, but I have hope. I have more control over my day-to-day work. Flexible working has been agreed. I need to be stronger, as Callum said, about setting boundaries, and I need to develop personal working practices that are stricter and protect myself, because it's still very tough. The workload is still demanding and targets keep getting higher. I have been sponsored to attend a Women in the Workplace Menopause Conference. I have promoted menopause support through my professional forums and at team meetings. So I do get the feeling that my organisation is willing to make changes and is looking to be supportive. A piece of advice I would give someone is to take yourself seriously. If you don't take yourself seriously, nobody else will. I have to keep reminding myself of that. Look at how the situation is really affecting you. Know your policies, seek advice, and put your welfare as a priority. Thank you. Back to Ruth.
Thank you, Sharon, for those really positive tips and approaches, and thank you very much for sharing that. So 2 more presentations to go. I'm coming next to Chrissy.
Hi there. Hello, I'm Chrissy. I'm a social worker in Bournemouth. I'm also a member of the SWU Executive and a union contact as well. And I'm also going to talk to you a little bit about menopause as well. I started going through symptoms of perimenopause at around 42. The average age is between 45 and 55, but it can affect people of any age. Can be a result of surgery or illness or function of the ovaries. I think there's not a lot known about menopause. It's all a bit of a secret. We learn about periods and we learn about pregnancy, but we don't need to learn about menopause because that's when we're past our best. So I think it is important that it's talked about so that we understand it. The term perimenopause is the transitional time before the menopause, and the menopause is when they officially stop. And these symptoms, they can go on for anywhere between 2 and 10 years. I think it's also really important to say as well that menopause affects anybody who's born with ovaries. So we need to acknowledge as well that trans people, non-binary, intersex as well, they experience this and with added complications. So we need to be really mindful of that when we think about menopause and when we're talking about it. So everybody's experience of it is different. Some people breeze through, no problem. Other people are really, really debilitated by this. The major side effects are the hot flushes, night sweats, anxiety, dizziness, fatigue, memory loss, depression, headaches, infections, joint stiffness, reduced concentration, heavy periods. So the biggest ones I've suffered with along the journey have been the insomnia and the hot flushes and the brain fog, as well as recurrent UTIs as well. So when you're at work and you're trying to do a capacity assessment with somebody and you can't actually remember their name, and you're sweating and you feel my sense of being a good professional was out the window because I was just a mess, and I really felt I was losing my identity. So before speaking to you, I spoke to some of my colleagues as well about this to see if anyone wanted to talk about anything, and they all came back with different stories. One lady was, she actually went through the menopause in her early 30s and was bleeding so heavily that it was costing her £70 a month in sanitary products. She would pass out at work. Another lady talked about how her marriage nearly broke down because she thought she was mentally unwell, and didn't believe that something like menopause could cause the symptoms. But the main thing they all said was that they just felt so alone and isolated, and the only person who could possibly be experiencing this because we're just not talking about it enough. So I'm very, very lucky in my job. I've got the holy grail of social work, which is a manager who says, how are you? And really cares how you are. And he wants to know how I am, and he will do anything he can to support us. But he's the first person to say, I don't really know anything about the menopause. And that 14% of social workers are men, but 27% of managers are men. So there's a lot of men managing a lot of women who don't understand this. And surely a mandatory training for managers around menopause would be, you know, a good way to start tackling this. I did look on our intranets. I'm in an NHS team, so I looked on the local authority and the NHS intranets, and there are policies there, but you have to dig for them, and they're new as well. They're not something that's been around a long time, and I think a lot of that is because there is this new focus on it. Obviously, the patron saint of menopause is Davina McCall, who started all of this happening on the telly, and it needs, you know, it needs to keep going. There needs to be more talk about it. Legally, if you're experiencing difficulties with menopause, there's the Equality Act. There's also Health and Safety at Work Act, and there's some really simple things that employers can start doing, like the flexible working options, being able to start a bit later if you've not slept all night, being able to, you know, sort of set your day how you need it, giving people the option to take breaks during the day, simple thing like providing a fan, drinking water, that kind of thing. So there's 14 million working days lost to menopause every year. So this is a big thing for everyone. So thanks, Ruth. That's I just want to say, if you're struggling, you know, speak up. You don't have to settle for it. It's not you.
Thank you so much, Chrissy. Thank you. Sorry, I had to just try and draw some close there. So because we've got our final speakers now, which are Carol and Tina. I think you're speaking together. So again, if you could introduce yourselves, and over to you.
Hi, I'm Carol Reid. I'm the National Organiser at the Social Workers Union. I'm a registered social worker and still work in community mental health, as well as for the union. I think the plan is for me to say a little bit and then Tina's going to follow me. I hope that's the plan, Tina, anyway. I'm sure she can give in if she wants to say anything at this point. The part-time working campaign was initiated by Tina of the SWU Executive. And as I say, she'll be speaking about her first-hand experiences in a minute. But alongside and corroborating this, SWU members were telling us of the increasing difficulties in finding part-time roles, particularly within local authorities. So we wanted to explore this further, as it comes at a time when employers are frequently discussing the challenges of recruiting and retaining social workers, many of whom, as we know, leave the profession due to burnout and pressure. Obviously, it's a very demanding role. It stands to reason, surely, then, that offering and enabling social workers to undertake more flexible and part-time roles would assist in overcoming these very real issues. And whilst job adverts often state that part-time and flexible is an option, the reality seems to be quite different in that applicants tell us they feel overlooked in favour of people free to commit to full-time work, despite their own experience, knowledge, length of service and commitment to social work. And I've had several conversations with social work managers and recruitment agencies who've explained anecdotally that the preference and priority is to recruit only full-time staff. Some recruitment agencies are told by local authorities to only provide full-time staff, and therefore these agencies have little opportunity for part-time work. On pursuing this further, I was told that the reason for this is that it makes the allocation of often complex cases for managers to oversee. It makes it difficult for managers to oversee, and I don't doubt that that's the case. But these difficulties shouldn't be projected onto the workforce, preventing them from working in ways that accommodate commitments, health and well-being, personal circumstances. And I've also spoken to managers who want to work part-time too, but who are also unable to for the same reasons and restrictions. So the first steps of our campaign, alongside Campaign Collective, we contacted our SWU contact team of social workers across the UK. We requested their experiences relating to these issues, and their feedback highlighted a requirement of real part-time options rather than flexible working, which often just means different ways of working full-time. Several explained that they're considering leaving social work purely due to the lack of part-time opportunities. And alongside Campaign Collective, we explored job adverts and vacancies. and discovered some quite disheartening stats. In May of last year, just 19% of social work jobs in England offered part-time or flexible options. Scotland and Northern Ireland was slightly higher, but Wales was lower again, with just 15%. It's improved slightly as we've had opportunities to raise this issue further by meeting with representatives from the Local Government Association, ADAS, Skills for Care and NHS professionals. And feedback from them has acknowledged concerns around this lack of flexibility when recruitment and retention opportunities should be paramount. It could be seen to be discriminatory for many numbers of reasons. Social workers cannot or may choose not to work full-time. And we're hoping that the part-time working campaign will enable opportunities for current and future social workers to access manageable and appropriate part-time jobs and flexible job opportunities to ensure they are able to remain in the role that they've trained hard for and want to work in. Home commitments, disabilities, neurodiversity, menopause, many other reasons shouldn't prevent them from doing this. So the advice we'd give is talk to team leaders. You know, it's what we've all been saying all along. Talk to your team leaders and managers. If you feel you need to change your working hours, don't suffer and just plod on, juggling other commitments. This may be detrimental to your well-being. And if their answer is no, which may well be their initial response, persevere and speak to your union. Make notes and records, get your voice heard, and get involved in campaigns like this one. When you discuss issues with colleagues, it's often surprising how many feel exactly the same. Again, something that we've all been saying tonight. So consider collective action when several people pursue an issue and make change, and maintain that link with your union. Thanks, Ruth.
Thank you. Thanks, Carol. I'll just see if Tina wants to come in. I'm not sure if I can see Tina now. Do you want to come in?
Hi, Ruth. I'm a registered social worker, and currently I'm not in paid work as a social worker. My story is quite lengthy, but I'll just try and be brief in that just before the pandemic, I'm a carer for my dad, and just before the pandemic I left my role in the NHS. I couldn't keep up with the shift work at the 7-day week, 24-hour-a-day shift work. So I left my role in the NHS to try and continue caring and look for a part-time role. Unfortunately, sadly, that's not happened, in that the local authorities and the NHS trusts where I live haven't advertised any part-time roles at all. I can't travel too far. All the roles that I see are full-time. I do sometimes approach some of the managers who give their contact details just to see whether there's any scope for part-time work, and 99% of the time I get a negative response saying that they really want full-time social workers and there's no scope for part-time at all. And I find it really frustrating at the moment, particularly with the recruitment retention crisis in social work. You know, crying out for social workers, all the teams are burnt out and overstretched, that they can't facilitate what, there's lots of people like myself who, for various reasons, need part-time work. And I just find it really, really frustrating. And sadly, I've also thought quite a few times of giving up my profession and, not continuing as a social worker. But, SWU has spurred me on, the campaign has spurred me on, and, that's where I've got my support. So if I can, give one message to anybody out there like me, it's, carry on if you can, get support where you can, and don't give up.
Thank you. Tina, thank you so much. We've had, I'm actually at the National Adults and Children's Social Care Conference this week. And I just want to say that the campaign that you initiated and it's been taken forward by SWU and Campaign Collective around flexible working and part-time working, that is being referenced in several sessions that I've been in, the issues certainly being referenced, and I believe ADAS are very well aware of what you've done, and the importance of this, and leaders recognising that they need to know if they are actually advertising. People think they're advertising for flexible conditions, but actually the adverts that go out don't say that. They say something much more constricted. So I'm going to suggest we now go to some questions, if that's all right, from the audience. Hi, Winston. Did you have a question for us?
What my issue is well, this week we've had a meeting with our managers. I gathered all of our colleagues. We were going through stress and burnout together to meet with our head of service, and I got everyone to list their concerns of things that's causing them stress and causing them burnout. And so in the conversation with the head of service, some of the staff felt like there wasn't being heard properly, or it wouldn't have been taken serious. So when you're in that kind of a situation, what do you think the next step would be?
Thank you, Winston. Does any of our panelists like to come in on that? Any thoughts from any of our panelists?
Yeah, I'll be happy to take that, Ruth.
Thanks, Lisa.
Yeah. Hi, Winston.
Hi.
Yeah. Well, first of all, I mean, well done and for getting a group together. Getting a group together is not easy, but starting with identifying a list and doing it in the way you're doing is definitely the way to go. I'm not sure, obviously you can talk to our team, which is the advice and representation team, but there is a really effective, powerful process, which is the collective grievance process. I have sat in on other areas. I've sat in with even a group of managers who have done it. And essentially it's the formal process where there's clearly the process is set out with outcomes expected, and there's also an appeal process, and don't underestimate the power of an appeal process is what I've learned. So that is a very quick answer. It's probably quite a bigger issue that you're going through, and I don't wish to not give it the time that it deserves. But what I would say is, as a member, please ring the advice and representation team, and our team will talk you through it. Listen more to the issues. So I hope that's okay. And it's just so important that issues are formalised, because the organisation needs to hear it right through at the senior levels. It's linked to practice development, Ofsted resourcing, the local politics. So I'll leave it there, but I hope that kind of just gives you a bit of a summary there. Thanks.
Thanks very much for that.
Does anybody else want to come in on any aspects of that? Or shall we go to our next? We've got another comment from the audience. Okay, right, we'll have a little think about that. So I think CSN, I am sorry if I'm mispronouncing your name, but it's our participant who's talking about how your employer is producing a women's health policy. And I wondered if you wanted to come in and say anything about that, because that sounds like something that sounds very positive, and I'm kind of wondering how involved are staff in that. Is that something would you like to come in on that? Hi.
Yeah, sure. Pronunciation was pretty good. It's Cersei, so yeah, pretty well done. Thank you. I think I've been quite lucky in terms of my employer and certainly my immediate manager. I think, and whether that is just referring to what one of your speakers has said, I think that in terms of my management structure above me, that they're all women, and they're all women that are probably 45 plus, so are either going through perimenopausal stuff or already have gone through sort of full menopause. So I'm lucky to be quite well supported, but certainly also went through the process of going to HR. I'm classed as disabled, as I said, so I have disability days, which really helps me in managing some of the sort of heavy duty symptoms that I have, which are mainly quite severe migraines. But in terms of the women's policy that's in the process of being produced, we actually haven't been involved in that. It's just sort of appeared, but it's something that I've been bashing away at for a bit with my manager, sort of saying that we really need something like this. And I think that, but I think that there'd likely been rumblings for quite some time from majority of women in the workplace. So I do feel quite lucky in that respect, but there's still a long way to go in terms of what the speakers have said, in terms of this being much more broadly recognised across. I think we're probably luckier in our profession that in the main that we do have a lot more women proportionately in the profession, so that there's a bit more strength behind it. But for it to be recognised sort of across all services really, and support services, the significant impact that this does have on us as a huge part of the workforce across all sectors, obviously not just social care and health. That's it really. So I'll be quiet. Thanks for the chance to speak.
Absolutely, thank you so much. That sounds like a really positive thing, and maybe a next step is just to say, can staff get a bit more involved in what's in the policy? Can we give you some feedback? We're really pleased that this, I guess, is something about collaborating as much as possible when managers and senior leaders come forward with great things, and then just asking how can staff be even more involved and make it even more inclusive is really important. We are actually nearly out of time, and according to my timetable here, I now need to go to Lisa, who I should say I think this event was kind of your idea, Lisa, along with other colleagues from SWU, but certainly you were one of the originators of it. And I think you're going to come back and say a few more words now to give some reflections on what we've heard.
Thank you. Yeah, I'm conscious of time, so I'll try and keep it fairly brief. I mean, just to say that, just to remind ourselves what an inspiring group of people we are. Our members are always, even when they come to us and things are difficult, what strikes me is that we always have to say to social workers, and the story is, how can you start looking after yourself? And we've heard some of those messages today. So I'm just going to essentially, what people were talking about today was it's important about sharing stories. Start with sharing stories, and the stories are often linked to disability, health, sickness, work stress, impact of menopause. What we know is that many of these workers are working harder for longer to keep up with their counterparts. This can't be acceptable. I recall a pregnant member of staff, heavily pregnant, high-risk pregnancy, doing more hours than she should be. So, yeah, I mean, obviously what we're saying is it's okay to speak up in those situations. And social work is a people's industry. It's okay to speak out and say, I can't continue, which is the messages we've got today. All too often, Callum and Sharon's stories currently are happening all of the time. Yes, we advocate for service users' rights, but it's okay for social workers to do that for themselves too. I hope that you can take some of the positive messages today, and there have been a number. But it's really important to let employers know if people can't work in safe and decent conditions, or they need to reduce their hours to look after their own family. And we've heard, great term, it's a sign of professionalism to ask. You can formalise these requests. There are procedures. Know your procedures. HR are full of them. I always say use your HR department. Don't get me started on that one. Look at the procedures, look at how you can use them for yourselves and others. And I mean, those are some of the positive messages. People have made changes, even if it's small steps, and that with some really, really great outcomes that we've heard today. So thank you.
Brilliant. Thank you, Lisa. Really stirring, lots of positive things to take away, actually, and lots of stories of recovery and change. Thank you. Next steps, I think, Howard, you're going to give a few next steps from SWU's point of view.
Just to say, well done everyone for contributing to this. You're all activists, you're all trade union activists. I know some of you are SWU union contacts, and hopefully there's some more future potential union contacts in the group as well. Decent working conditions have always been fought for and won collectively through trade union membership and activism. And when you join BASW, you have the opportunity to also join SWU. which is the Social Workers Union, the only union specifically for social workers. And you can become involved in several ways. You can become a SWU union contact, promoting the union to colleagues, to students, sharing information and encouraging membership. You can become a phase 2 contact, assisting A&R team by supporting colleagues in workplaces and providing low-level representation. As a member-led union, we encourage members to initiate and contribute to their own campaigns, as some of you have, with the support of Campaign Collective. And of course, we've got our Austerity Action Group, which promotes grassroots activism, attending marches, demonstrations, and led by activists with many years of experience, including Angie Naylor, who is here in the audience. So if you'd like to be involved in your union, just drop me an email and I'll happily provide any more information and answer any questions.
Thank you. Thanks, Carol. There's information in the chat, I think, about how to get in touch and about some of the other resources, including the Working Conditions Toolkit that SWU, BASW and BASW University worked on together, and other resources there, and information about the campaign fund that SWU has. That just leaves me now to say thank you ever so much for everybody who's contributed, to Sharon, Lisa, Parveen, Deb, Callum, Chrissy, who have I missed out? Hope I haven't missed anybody out. All of you, Tina, thank you so much for all of your contributions, and thank you again also for Campaign Collective and Simon in the background, who has been working to make sure this happens. So thank you, and hopefully we'll see you all again, hopefully on another event, and good evening, and thank you for being with us tonight. Thank you. Bye-bye.